I actually have a question because I do marketing, right? I have a marketing for my clients, and one of the things they always talk about is no show and show rates, right?
Hmm.
And I'm just curious, like based on your experience, that do you find that if somebody actually fills out the new patient form, gives their insurance, and does all those things before they're a new patient, I'm talking about for the,
Hmm.
that they are more likely than not to show for that appointment?
They will show. If they're filling out all their information and going that extra step, they will show. Absolutely. You know, I mean, I've worked in offices where they waited for the patient to come in, okay, to gather their insurance information, to do everything. And what I find is that the staff is going crazy at this point. They're in the back, they're trying to get the insurance on the phone, rushing around, then having to do a treatment plan. Um, and what if you're not able to get that insurance on the phone right away? Then you're waiting, the patient's waiting. The patient doesn't want to be there for 2 to 3 hours. They want to get in, get their cleaning done, then come out, go over their treatment. They want it, to be easy and streamlined. So what I found by working with someone who did that and, needed all that information once they got there, it was crazy. Everyone's going crazy. They're running back and forth. I mean, it's a lot of stress. So, why not take that stress away and, do it beforehand? So, say the patient doesn't show up. Well, you know what? At least you were prepared for all of that, you know? And then, what I find is that people show up when they fill all of that out. It's like, it's like they're committed to it, right? 'Cause they're making that commitment to filling out the forms. And some of these forms are in detail, especially, today. You need to know their medical history. It's like, and sometimes these patients have a long history of medical things. So, and also we want to be able to see that before they come in. What if they have heart issues and, we can't treat them that day because we need med clearance. So that's a lot of, information too, and not wasting their time or ours, at that point. And then we can say, okay, you know what? You have this condition. Let's, get your cardiologist on the phone. Let's get med clearance because that takes a while too. Trying to get a cardiologist and whatever to sign off on something is not easy either. Takes a week, could take 2 weeks. So getting all that information beforehand is super, makes everything super easy
Hmm.
or less difficult, I should say.
Right. Okay.
It's my
Wow.
experience.
There's a lot to insurance. My goodness.
Yeah.
So let's see.